There are many more questions about the coronavirus crisis. To help us answer some of them is Dr. Robert Tiballi of the Catholic Medical Association. And doctor, experts are hard at work searching for possible treatments for infected patients. And one technique involves the blood of people who've recovered from the disease. How does it work, and is it promising?
Well, the use of convalescent sera or antibodies is very promising because what it is, it's a blood product, an antibody, which a person's body develops after they've been infected with and cleared the coronavirus. And this is what provides them to have immunity. It's the production of these antibodies that help them get over the infection in the first place. And if they're able to donate sera, which is the fluid that the red blood cells are suspended in, it could provide a product that could be life-saving.
All right, let's talk about face masks. For a long time, there were conflicting accounts over whether everyone should wear a mask. Now people are being encouraged to cover their faces. And during the Spanish flu pandemic in 1918, everyone seemed to be wearing one. Why the differing advice now?
Well, the face masks used back in the Spanish influenza outbreak were basically cloth masks that needed to be washed. They were not as effective as even the paper composition masks that we have today. This is another example of moving the goalposts with the recommendations here. The simple underlying foundational fact is that we don't really understand what's going on with this virus transmission. We think we understand, but in 2 or 3 days, sometimes we get information that causes us to change the goalposts and offer different recommendations. At this time, in the medical centers where I work, we are required now to wear face masks at all times throughout the day in direct patient contact and not direct patient contact. And so this may lead to decreased infections of providers. Patients or citizens are being recommended to wear face masks now in public. And this may be not as effective as one would think, but it may be helpful in reducing some of the contagion that we do see. This may be part of the fact that these particles tend to hold in the air for a prolonged period of time. And one study showed they can stay in the air for up to 3 hours.
All right, now I'm going to read to you a question that we just got from one of our viewers. She says, my daughter is 33 years old, diagnosed with Crohn's disease at 19, currently on no medications. Does she have to be extra careful if and when she leaves the home?
Well, if she's on no medications, we would not really judge her to be more at risk from this infection. If she were on potent immunosuppressive agents, she actually might be at higher risk, or some of these immune suppressant agents are actually being investigated as possible treatments or to interrupt the intense inflammation that people can develop at the lung level. But if she's just got Crohn's, on no medicines now, or on local therapy, intracolonic therapy like Asacol or something like that, then we wouldn't really believe her to be at increased risk.
All right, because I know a lot of people are nervous when they hear, oh, this person got the disease because they have an underlying condition. But that's not always the case, right?
Well, those underlying conditions that they're speaking of are usually immune system related. So if you are a cancer patient on chemotherapy, if you have a history of CLL or chronic leukemia, or if you have leukemia, if you're a solid organ or liquid organ bone marrow transplant patient on anti-rejection medicines, if you have severe heart or lung disease, including cystic fibrosis, advanced COPD, even mild COPD, or heart valve disease, these are all higher risk problems that would place you at greater risk if you did develop the coronavirus.
All right, we have so many more questions, but we'll have to stop there. Dr. Robert Tiballi of the Catholic Medical Association, thanks for joining us and answering these questions.
My pleasure to be with you. Be safe.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.